Hello, welcome everybody. Good afternoon. Welcome to the fourth and final dialogue in our digital strategy. My name is Sinéad. I'm a member of UICC's capacity building team. And it's great to see so many of you joining us and some familiar names. Some of you have been to a few of the sessions in this series already. So welcome back and welcome to anyone new joining us today as well. So before we get started, I'll just quickly go through some of our Zoom etiquette. We'd like this session to be very interactive, so we'd ask you to keep your videos on and to keep your microphones on mute also, just to avoid any background noise. You can also open the chat box and the participant list. And we recommend that you use the chat box to share any of your questions or any comments you might have during the session. And I'm very happy to welcome back our three digital consultants. We have Zoe, Rebecca, and Jenny here with us today. And they've been coordinating this series over the last number of weeks. So without further delay, I'll pass you on over to Zoe to get started.
Thank you very much, Sinead, for that very kind introduction. Myself, Jenny and Bex. Jenny and Bex, do you want to give everyone a wave? We're very happy to be back here today for the final in the series. So far in the series, and I know some of you have attended the series so far, so great to see people back again, as well as some new faces. Just to recap on what we've looked at so far, in the first webinar we looked at digital leadership, the next webinar we looked at digital fundraising, following that we looked at digital service delivery with Bex last week, and this week is really the week which I hope brings everything together, where it's an Ask Me Anything session. So for those of you who haven't been to an Ask Me Anything session before, it literally does what it says on the tin. It's about firing some questions at us and getting us to answer those, so please do feel free to grill us as part of this session, but we very much want it to be a two-way dialogue. We also want to hear about the issues that are most important to you, and above all, because we know there are some fantastic examples of innovation and great digital work going on in the UICC community, we want to hear from you where you may have tackled these challenges too. So as we get further into the webinar, we'll be asking all of you as well whether you face similar situations and what you've done about them. And don't worry if you feel that you haven't done certain things perfectly. Today is very much about sharing what we've learned, taking stock from the last couple of months where we've all been going through the crisis together, and thinking about what good looks like in digital and answering some of those big questions. So what we're going to start with is an icebreaker. And I know some of you have very kindly shared some questions already, and you've emailed those over, and we've seen those and they look great. We thought it would be good, as well as looking at some of those questions later on, perhaps to start with the questions that are top of mind for you all right now. So what we'd like you to do is to think about the one big burning question that you have that you'd like us to answer here today. Perhaps it's something about digital that's keeping you awake at night. And what we'd like you to do is take a moment to think about that, pop it in the chat box when you're ready, and then we will kick off with some of those questions to get the discussion going. So we'll give you a moment to do that and then take a look at the questions, and then we will take it from there. So off you go.
Hello, may I ask you?
Oh yes, if you would like to kick off with a question, that's great, and then perhaps everyone who's still writing their questions can pop them in the box.
I have previously sent just topic which is really hot for me. I am Akasa Nikidze from Georgia, and we are going now to create some kind of maybe apps and virtual clinic and so on to use these technologies to translate maybe claims and some confusions of our patients to the language of apps, virtual clinic, and my question is about your experience. How we should start creation of health apps, and how we can use them more efficiently, not only on this with regards of this COVID-19. Even before COVID-19, we had these problems with patients who are with kind of disabilities or chronic illnesses and have problems to come every time to clinic. Thank you very much.
Brilliant, thank you. That's a great question to start with. So how you begin the creation of an app, and what I would always advise there is, before you 100% decide whether an app is the right thing to do, you begin with really understanding what those user needs are. So beginning by doing some research, by talking to users and finding out the challenges they're facing at the moment. Bex, do you have any thoughts on that? Because I know you do lots of work in digital product and service delivery.
Absolutely, would echo what you just said. So probably park your idea in one sense and go back to scratch. It's always helpful to do that. I've had plenty of ideas myself that might not have been the best idea, so I've had to park it and then go back to the beginning, really think about what the problem is you're trying to solve, get to know your users and try and figure out whether an app is the right answer for that. There are plenty of positives to apps and app development, but there are also a lot of negatives as well. People have to download something onto their phone, which is a barrier to use, actually the stats around app use are quite interesting, that everybody uses apps and there is a lot of use of apps, but it tends to be 1 or 2 or 5 apps that they use, and they'll be the big apps. They'll be WhatsApp, Facebook, Twitter. So app use is actually not something that's an easy win. If there's a real reason for it to be an app and the users need that thing that you're creating, they will use an app. So it's not to say that apps won't work, but it's really good to take a step back from the concept of app and just really have a think about what actually might work instead, or what might be the better digital answer to the question that you're posing.
Brilliant, thank you, Bex. Does that give you a steer then? Does that answer? Is there anything else you want to ask us about that? Ika, is there anything else that you wanted to ask us? Okay, brilliant. Well, I'm going to assume that's all right. Wonderful. Well, why don't we move on to our next question then? So we've got lots of fantastic questions here. Thank you so much for sharing them, everyone. Dr. Hadi, you've got a brilliant question here about digital fundraising. Would I be able to ask you just to tell us a bit more about what you're currently doing in that area, and what advice we could, what kind of specific advice you're looking for, and then we can answer that question.
Thank you so much, Zoe, and thank you, Sinéad, for thank you everyone for having this, and UICC for having this a great platform for networking and actual collaboration. So let me put it that way. Let me describe the problem that we are having here. In Qatar, a lot of people are willing to donate, and they generously for helping and covering the fundraising for cancer patients, to cover for their therapy when they need it, to provide them service. The things that we are facing challenges when we approach a donor or approach a partner to fundraise for awareness activity. So give them a project, a series of campaign, a project related to public education, public awareness, and also education activity for healthcare professionals. One of the major things is to invest in filling the gap regarding primary care provider. So the GP or general healthcare physician will provide them for continuing medical education, that they will actually pick the case right and refer the patient to the specialist. That's one of the things that we took that area of the puzzle and work on it in that area but it's always challenging to go to donor, how you convince them to donate for this. This is the, if you guys have an ideas and success story previously that we could build on it. Sorry, one more point I want to add. So because the money that we get fundraising for cancer patients to support the therapy fees, we cannot use it for the educational activity. It's like SEP 2 fund for covering the cancer patient therapy fees, and another fund for the educational activity, including public and healthcare professionals.
So that's a really interesting question about how you get people to fund different activities, which I think relates to how those different activities are perceived. I'm going to hand over to our resident digital fundraising expert, Jen, to answer that question. Jen, do you have any thoughts on that?
Yes, thank you, Dr. Hadi, and thank you for coming along to all our sessions. Great to have you here. Yeah, it's always a problem with a lot of organisations. There's always like the more interesting, emotional things that people are willing to donate for compared to the less exciting sides of an organisation. I mean, it's similar to organisations that need to just cover their kind of staff costs and admin costs, as much as that kind of awareness raising activity. So one option, which I know some organisations do, is that you, all those things that are a bit harder to fundraise for, you actually go to kind of sponsors and corporates for that side of things, so that because you know that you're much more successful in that kind of more emotional, personal side of donate to help this individual, as opposed to donate for us to do a campaign or donate for some staff time. Whereas sometimes organisations can be really supportive, knowing that their money is going to that kind of core costs, especially if they get some kind of promotion from it as well. I saw something the other day which really resonated with me, and it's so true when you think about fundraising, is when you're, especially when you're working with corporates and sponsors and the kind of organisations rather than individuals, and with individuals too, it should always be a bit of a two-way thing. So it's kind of, rather than like, oh, we've got lots of poorly people who need your support, give us your money. It's kind of, we'd like your money, but we are going to do this for you as well. So are you going to promote them? Maybe you put on your website that they are, thanks to this sponsor who have funded us for our core activities, so that every penny that individuals donate goes to the individuals, or something like that, that kind of two-way partnership. The other thing, if that's not an option, is to have a very specific fundraiser, a kind of crowdfunding campaign or something like that is for something quite specific, and you explain, it's all about bringing it back to what is that money actually doing. It may be for a campaign, but ultimately that campaign is going to make people realize they have cancer sooner, make people go to the doctors sooner, or whatever it might be. That awareness raising campaign has got a deeper purpose. So going back down to that deeper purpose when you actually start promoting that campaign, or when you're speaking to your donors, or depending who it is, it's always bringing it back to that kind of, it may be for this, but actually ultimately we're going
Jenny, thank you so much for your idea. So so regarding your point, it's excellent point regarding corporate. This is actually what we do with the corporate. We go approach them, and you're right, for any awareness and education, we usually go to the corporate, and we work with them, and we provide them recognition, appreciation, our website. Even we give actually awareness sessions, and we give them even discount for early detection test for their employee through our partners. That's something we provide them, and give them a priority in the appointment for their staff to get seen quickly. But the point that here the situation in Qatar, we have individuals that they are really wealthy. So when we go to them, we approach them. The reason why we want to, it's more regarding convincing key donors to donate to awareness and education activity. And we are building this culture, and I agree, I totally agree with you. We are building that this money, yes, is giving to a campaign, but also it helped to prevent cancer. But this is the challenge that we are facing is the key. I mean, like I'll tell you example. In Ramadan, we had people that actually, some of them, they donated through the campaign that we did digitally through WhatsApp. Some of them, they donated like 2 million riyal, which is, that's like $500,000. But they said that donation, it's all for cancer patient therapy. When we started to discuss with them, it's education, awareness. They prefer all of that for the patient. And that's one of the things that I was wondering if you have crowdfunding. It doesn't have that much presence in Qatar. That's why I was talking, if you guys have digital format, we put the project in our donation portal, we promote it to people, but we have, I was wondering if you have like a success story, actually, that a project you are aware of, a real project that was collecting donation for awareness activity, for educational activity. I looked around, I didn't find let's say, I will find pieces. I don't find a full experience, full experience from A to Z. So we kind of go through the step when they design that experience or that project. This is what we want to, if you guys from your expertise, if you had work with a partner that asks you to assist in digital fundraising for health education, health awareness, what could be applied to diabetes could be applied to cancer. A digital campaign for fundraising for health awareness campaign or activity or project. That would be great.
I can't think of anything off the top of my head right now. I don't know if anybody else on the call has any examples of successful fundraising campaigns that were for awareness raising. So does anyone have any examples? I'd say my one other point, which I think you probably know anyway, is kind of trying to show the evidence of what past awareness campaigns have done. So if I can think of one successful one in the UK, I can't think what it's called, but it's for breast cancer and it's about checking your boobs. Does anyone remember what it's called? And they have all sorts of
yeah, I know the website.
And they're all about awareness, and they do really, really well. They do a lot of kind of going to events and all sorts of things online. I don't know the details, I haven't been involved in it myself, but does anybody else on the call have any ideas or examples of their own?
Oh, actually, I want to add something because we have really problems with fundraising, especially for information educational campaigns. Only pharmacy companies are interested if there is any interest to offer some of their drugs. Private clinics are interesting if you are offering treatment and diagnostic process to conduct for patients in their clinics. So I really thought always, because I am managing oncology group at Georgian Patient Union, that advocacy for some health education program, state program of health education, not only for oncology patients, but in general, and especially for oncology patients, should be funded by government, because there is some, there is actually some program, state program, for promoting health education. And there are even some NGOs which are working especially from promotion of health education. But we don't have any health educators position in private clinics or state organizations. This is first. And second, as you said, if there is something about funding, everybody preferring to fund some concrete action or treatment or diagnostic tests or timely detection actions than information education campaigns, unfortunately. So our experience is to translate international organizations ready printed materials, for example, which they are sending to us, and funding translation process. For example, more concretely, I am communicating with European Oncogynecology Society, and if they are funding translation and printing of their materials, EduEngage materials, we are printing them. For example, you can see here, we are printing this kind of educational materials for ovarian cancer, for example, for cervical cancer. But this is, as you can see, Engage materials, and we are just translating them. So international funding is more working in my country than local funding for educational campaign. This is our experience. Thank you.
I think that's a great point. And if I could perhaps just jump in there and share a few things from my experience. I absolutely agree with all the points that have been raised so far. I think it's really hard, if I'm honest, to get fundraising purely for awareness campaigns, and I was trying to think of some workarounds as you were all talking there, because I'm just thinking, how would a corporate perceive this as an ask, and particularly in the current climate, I wonder whether the appeal there is very much about the tangible thing that they would be funding. So perhaps it's I don't know, funding 50% of a staff member's time to work on this campaign rather than fund the campaign, because I guess what they're always going to be asking about is the return on investment from funding the campaign, which can be quite hard to show. So I think perhaps parceling it up as this is a tangible thing we need to deliver the campaign, and there of course you could link it maybe to some stats around reach, which could be quite appealing for them, because my understanding of corporates is that's something they always ask for in terms of corporate partnerships. What you have touched on there, Dr. Hadi and Ika, as well, as a point which I'd quite like to just pick up on briefly about that funding for core costs, because I know it's a challenge for a lot of organisations, particularly at the moment. And in the spirit of sharing failures, I want to share a story of a hospice that I saw where a capital campaign went wrong. It was not something we were involved in, it wasn't one of our clients, but it was something that happened in our local area. And I think it's almost a case study in what not to do, so I thought that's why it might be quite helpful. So this was a hospice, brilliant, very well regarded local hospice. And what they did was they were trying to raise funds for a new building. You know, great idea, very emotive cause, very appropriate to get the message out in their local community where lots of people would have connections with the hospice. But what they didn't do, which I was slightly surprised by, and which I understand to be best practice when you are looking for fundraising for core costs, is you would normally get some major donors committed before you went public, because obviously people are more likely to give if they say, oh, this other local business has given, or this other high net worth individual has already donated. And then also to make sure that you've got a really clear plan for the different milestones of fundraising and how you're going to get the communications out about that. Because I think if you go out there with core costs campaigns, which are, you know, in theory open-ended, where they don't have urgency, where people aren't clear about how progress is being made and who's already involved, then that's something which can have a detrimental impact on fundraising. And very sadly, this hospice didn't make anything near their target for the new building, which is a real shame, because the impact of that building on the people who are receiving end of life care at the hospice could have been really, you know, really quite significant. So hopefully that's some useful advice about how to go about tackling that general area of core cost fundraising. Great, thank you. Is there anything else you want to ask us on those points, Dr. Hadi?
I mean, I think it's a challenging point. We keep working on it, and you know, as Jenny mentioned, we always try to kind of how can I say, connect the outcome of that awareness activity into cancer prevention. So we are thinking of saying like, okay, if you gave awareness, I don't know, 5,000 people, 500 people, and even we are looking evidence for that. If you increase the awareness of 500 people, 10 of them, they will go for screening. So you save the life of 10 people. This is what we are trying to look even for evidence for this, documented evidence to share it, to base our, let's say, the claim that we are doing in the description of the project or the fundraising campaign, to back it up with evidence. So that's one of the things that we are looking for.
Yeah, I think that's a really good point, where you can share it's linked to some really tangible outcomes. That could be really powerful. Brilliant, great. Well, it sounds like you were making some really, really good progress, doing some great thinking about that area. There was a really interesting question that came in from Pragya, which is about a digital platform, which I know Bex was particularly interested in. So Bex, do you want to say a bit about the question, and then we can work out how to tackle it?
Yeah, so Padja, you've asked if UICC would be interested in creating a digital platform that all members can use for health promotion. It also kind of links in with Sheila talking about partnering with telecommunication companies for creating a digital platform worldwide that will be available to all members. Obviously, I can't speak on behalf of UICC and whether they would like to develop this, but I did just want to talk about how collaboration can be massively impactful when creating complex digital products, because you will all have very similar challenges that could potentially be solved by clubbing together and designing and building something together. I've had quite a few experiences where I've developed digital products in this way. And one example I wanted to share was charity shops. So across the UK, lots of different charities have physical shops on the high street to raise money for their charities, and there was a need that we noticed in our organisation that these shops needed more stuff. They needed couches to sell, for example, but people were not able to bring the bigger products, for example, like a settee or a couch or a chair or a table. They might not have had transport available, like a van, to take that product to the charity shop, to donate it to the charity shop. So a lot of the charity shops actually had vans, but this wasn't something that people knew about generally. So they didn't know that they could call a charity shop and say, we've got a table, would you like it? And that the charity shop would actually come and pick it up. So this wasn't something that people really knew about. Also, people don't actually have brand loyalty to charity shops. They just want to donate their stuff to the closest charity shop. They don't really mind whose charity shop it is. So there's a benefit there for all charity shops to kind of club together and find a solution that will help people raise awareness of all this kind of this stuff going on in the background that people don't know about charity shops. So actually there was a benefit there, although I was saying apps don't really work. In this instance, an app would be a great idea for somebody to take a photograph of the table they want to give away, and it would be uploaded to a central database where all the charities have access to this database. So the nearest charity can just say, yes, we can take that table, and then an alert would go back to the user to say, your local charity shop will pick up your table at 9 a.m. tomorrow. Very like smooth system that would work. But in fact, in this instance, it would only work if all charity shops were on board. They needed the amount of people in the background working on this to say that, yes, we can pick this up. So you didn't want users submitting a request and then nobody's there to answer it. So the benefit here was collaboration with all different charities getting on board with this. Another benefit of collaboration here was user base. So it was not helpful to have every charity under the sun create their own app for this. It was better to have a centralized app so that users knew, I just go to this one app and that's where I get rid of my stuff, because there is no brand loyalty. So it was better for users for just to be one app, for them to go to, understand that I just go to this one app and I can get rid of my table. So that was a really good example of how collaboration would have worked if the charities all came on board and worked towards this together. unfortunately, the challenge with these projects is often the collaboration aspect. So I think that project ended up falling apart again with the sense of happy to share failures, and it fell apart because everyone decided they wanted ownership over this and they wanted to do their own apps. So I think it ended up that 3 different apps were created by different charities, which obviously ended up not being helpful for all those reasons that I suggested about collaboration. So centralization can really be helpful when we talk about digital products. It can also make it a lot cheaper to develop that product. So there's also a second story, another product I worked on that had the benefit of locality as well. So often people want to donate to a more local charity or a very specific cause, but you can still do the behind the scenes development of a tech product. And then what you can do is white label it. So you can put your branding over the top of it, but the core costs, the complicated bit in the background, which costs the most money, will be covered. You can split it between 12 charities, and instead of it costing 100k, it's going to cost you a lot less between you, and you can still brand it up as your charity. So there's loads of ways you can collaborate on a tech product, and actually, you know, you can build a tech product quite cheaply if you want to, but to get it right and to make it really work, you need to do proper user research, you need to be thinking about behavior change techniques, you want to bring in gamification, and of course you can't just build a product and hope that people come and use it. You have to do the marketing just as much. I usually say if you're going to spend X amount of money on a product, you need to spend exactly the same amount again promoting it and getting people to use the product, because usually without users, a product kind of doesn't really work and it becomes a moot point. So duplication is a waste of time for everybody. It's a waste of time when we think about social good as well. We don't want to be spending the same money over and over again on the same products. So where you can in this room come together to build products, that's going to be better for everybody. It's going to be better for the users, it's going to be better for you, it's going to be cheaper, it's going to be a better product. So, you know, there's a chat going on now about these products. If you're all having the same ideas in this chat, maybe have a conversation after this call and see if there is a way you can come together and collaborate on those products. I don't know if anybody's got a story of collaboration actually where they've done this maybe with another organization.
I could share a story, not in Qatar, in Oman actually. In Oman, what they have all the charity got together in the same application. So when people want to donate, they just go to that web app and they pick the charity they want to donate to, and they give their donation. And they all got together and they created, instead of having multiple app of charities, they have one app, and they share it.
It's a perfect example of it. I think it's a place where we don't use it as much as we could do collaboration. It can definitely help.
I think that's such a brilliant point, and I'm so pleased you asked that question, because absolutely agree with what Bex was saying. I mean, so often I think what we will see is that multiple people go off and reinvent the wheel, and you'll find that several people are developing exactly the same product at the same time, and particularly given the nature of this community and the central problem that you're all trying to solve, definitely looking for those opportunities for collaboration and reusing what's out there already is absolutely key. Perhaps I could ask a question of you, Bex, if that's okay, just about that collaboration point. And you obviously talked about where the collaboration itself was a bit of a challenge, and I have to admit I've seen that myself on projects too. Is there anything you would advise the delegates here today about how to get that collaboration off on the right foot and grow that relationship?
Great point. I suppose the starting point is bringing everyone along right from the start, and I think it does take a little bit of soul searching as well. We all want ownership over stuff. It's kind of natural in human nature. You know, you might have come up with an idea, you want that, you want kind of a level of ownership over that idea, but I think, you know, really shedding that and allowing the idea to be something that is owned by multiple people. So, you know, whether this idea needs a contract where that ownership is very equal amongst the partners, whether you develop a whole new brand and website which takes it apart from your organization, you know, during the development phases, just to make sure everyone feels like they've had a say. And I would also say bring people on board as soon as possible for the same reason. If you can do that initial development and research with those other partners instead of bringing them a fully realized product, they're going to feel more embedded into the process and feel like their views have been heard as well during the development process.
Jen, sorry, I think you're on mute, Jen.
Oh, I thought I'd unmuted. I think I remuted again. Sorry. Also, just to add that I know Bex has already mentioned a couple of times earlier in this session and in hers is listening to the users and getting that evidence base. So if you're working as collaboratively with lots of different organizations, maybe your users are all very similar, maybe you've got slightly different users, so you want to make sure you get an example from all the users from your different organizations, and bringing that together so you have that evidence base of like, actually, this is what the users want, because exactly what Bex just said of often kind of, oh, it's my idea, like I really want this to happen, this is my idea. It's like, well, your idea is great, and that's what started off this new, better idea that is influenced by the users. So I mean, I know it was something when I've worked quite a lot in public sector on kind of digital products and stuff, and we'd get a counsellor or a director that would come to us with their brilliant idea, and we'd be like, well, actually, we've done some research and people don't want that, they actually want this instead, and trying to get them to let go of that idea and move on to something else is quite tricky. But if you show them that evidence, those stats and proof and user interviews, they can't really argue, and you know that you've got something that's collaborative and it's putting the users first.
Yeah, and I always like the ideas of risk and power, and thinking about who's got the power over this product that you're developing and who should have power over the product you're developing. So power, you know, the power dynamics are constant in digital design. If you're building something that people have to pay for and sign up to, you have a lot of power. You have power over that data, you have power over the service that you're designing and what you're going to give to people. But actually the power should really sit with the people who are using it and are accessing that information. So thinking about power, but also thinking about risk. If it's your idea and you're kind of giving that idea over to people when you're co-designing or doing co-production with the users, you know, you are giving risk away in a way. So it is a hard thing to get over. But I think risk and power is better to think about than ownership over products.
Brilliant. I think there's a great point, and I hope that will get everyone thinking about what good collaboration looks like and how we can consider products from the perspective of users. I think Bex and Jen are absolutely right on that. It's got to be the touchstone for all the digital products and services that we will develop from here. Fantastic. There's so many great questions coming in. I feel like we're spoiled for choice today, which is wonderful. There's a really good question from Carolyn Taylor here, which are about strategies for digital data collection, where access to and affordability for the internet and data might be a challenge. So Carolyn, can you tell us a bit more about the situation your users are in, and then we can advise on that?
Yeah, hi, good morning. I'm in New York, so it's morning, sorry.
Oh, good morning to you.
Yeah. So, yeah, we were supposed to launch a video-based educational program in Vietnam and Colombia in March, which was designed for patient and caregiver education and designed to be delivered in the hospital setting in the waiting areas. So we obviously have to redesign the delivery of that, but also the data collection around that to prove the efficacy. So where we're challenged is once we do launch, and we can figure that out, but how the data collection, we were going to use focus groups, we were going, you know, how do we access people in a safe and effective way because of COVID? You know, and using data collection and to conduct surveys and interviews where people might be challenged to have access to data and internet.
So this is such an interesting point, and actually we're seeing some massive issues in the UK at the moment around the digital divide. So I can share some thoughts on that, and it's not an easy problem to overcome. But just to clarify a little bit about the situation that those users are in. So it's to do with what's the nature of the specific challenge there. So is it that they literally don't have devices, or is it not having the money for data, or is it's skills? What's your feeling on where they're at?
So I think in the different countries it's different. So generally, specifically in Vietnam, there's one person in the family will have a smartphone. Data is fairly inexpensive there, but there are challenges around people being able to use it for a period of time. If there's just one phone, how do we, ensure that? And in Colombia, we're not quite sure exactly what the challenges are, but we do think time-wise will be. We know in Vietnam it's about a 60% penetration of smartphone, and it's about the same actually in Colombia. So it's a penetration of that, and then it's going to be a mix. So we're not exactly sure, the specifics to address, but in general, are there sort of interventions that kind of work around that to make it more generally available that you know of, or ways that we can forego data or having to have access that would be safe for patients. Still, I know we can do it when they come in for treatment. We can have nurses or research assistants go in and safely conduct. But if we wanted to have like a group chat, is there a way to kind of be able to do that? Because I think focus groups are really important to this, to get that understanding from a group and drive a conversation that leads to different things, right? So is there a way to do like house a focus group that wouldn't be challenging for people with limited data collection and service?
So this is such a great question. So I'm going to share an example from a charity that work in Africa that I just came across recently, where I think it's not exactly the same situation, but there is some overlap and some ways in which they've dealt with something similar. So I don't know whether you've come across, there's an NGO called Send a Cow, where they do lots of work in Africa, where they're basically helping rural communities and to help them be more self-sufficient and skilled up. And one of the challenges that they have in getting the information and awareness about the work they do is also that one about the digital divide. So obviously there are large parts of rural Africa where there is no connectivity and not everyone has a smartphone. So they came up with this really interesting workaround where they've basically appointed digital champions who are farmers who've got just good networks of people. So they're the person in the village who everyone would go and talk to when they had a problem, and they make sure that those people have got smartphones, and I think they actually provide the devices to them, and I imagine some kind of resource for the data as well. And then they make sure that they talk to those champions regularly, that they are aware of the messaging of Send a Cow, and then they ask that person to go out and share the message with people, obviously in a responsible, socially distanced way. So I wonder whether there's something there, because you mentioned that there perhaps being one person in families who had the smartphone. Is there something there where you can effectively almost outsource the focus group stuff to them and ask them if they can, if they can take the temperature of people on these particular issues and share feedback with you? Obviously you need to give them some quite clear training and feedback mechanisms and help them understand the stuff around data collection, the regulations in the country that they're in. But that's my instinct. I think something about building on where you've got people who do have access to digital, almost spreading the word the old-fashioned way, rather than trying to get everyone a device or data, might be quite challenging if you can't always reach them.
Right, sorry, maybe I didn't explain it that well. So it's actually on the feasibility and acceptability of the program itself. So it was more around the data collection for that. So it is like IRB based research. So I don't think we could just use a community person like
Right.
for ethics and appropriateness of it. So, but maybe there is a way to do it through, we do partner with the universities of public health in those countries too. So maybe there's a platform that we could explore, just thinking along how you were saying that maybe there's actually an educational platform that we can look at that's existing right now or is coming out of COVID, right? So that we could tap into for delivery of information, you know, the way education is transitioning into the time of COVID. So maybe we can look at research in that way too. Basically just thinking out loud while we're...
Yeah, excuse me, Zoe. Can I talk, Carolyn?
Please do, Dr. Hadi. Yeah, go for it.
Carol, I'm interested, you know, research is and I'm involved in many IRB. Carolyn, can you state your problem? What's the that you are facing? So you want to do focus group?
So yeah, we wanted to do focus groups originally for the original IRB was to do individual interviews and then focus groups with you end user. So after people view the videos, we want to get feedback on what they thought was valuable, what wasn't, so we can adjust the program accordingly and then move forward and also publish on the work.
In an encrypted method you want, so in a private encrypted method.
Yeah, it has to be private.
Encrypted, yeah. So so regarding program that they usually encrypted, and you could actually do interviews, research interviews, and encrypted. Let's say like Zoom, it's not encrypted, so I would not use Zoom. Zoom is they have privacy, it's not encrypted. Even business account, I mean, you could get the business account, but it's there is a questions about how well it's encrypted and the privacy in conducting research on it. Other program, maybe, I mean, the other program that I'm aware that they've been used for research for encryption, Google Meet. So they give a presentation, they give the information, they review it, and they then. So this is they meet the standard of HIPAA compliance and doing research. You know, this is other. I mean, unless you want to do like and what's nice about Google is they have a blended form, so you could actually put the video for them. They watch the video, and then you could do interviews, and it's all in a HIPAA compliant.
Google Classroom.
Yeah. It's all HIPAA compliant. By the way, Google Classroom, it's used in the region. Let's say it's actually the reason why I'm because I have a group of my colleague actually doing a study in Iraq, almost the same format. So they give educational information, and then they will do questionnaires, interview regarding focus group regarding that research, and they are using Google Meet and Google Classroom. And it's all HIPAA compliant and encrypted information. So that's what I mean. You know, I think that's one idea. Other thing, if you want to actually to send them a questionnaire to answer, I know for sure this is WhatsApp. It's a lot of IRB approve it because it's encrypted. The communication that you're gonna do with them, it's encrypted. That's other thing.
And WhatsApp is really widely accepted too.
In IRBs, I mean, you know, yeah, it's more accepted than telephone, by the way, because the SMS, it may not be encrypted. It depends on telecommunication company in which part of the world, but WhatsApp is encrypted. So actually, a lot of IRBs in the region, they are accepting WhatsApp communication.
Thank you, Dr. Hadi.
You're welcome.
Thank you, Dr. Hadi, and thank you, Carolyn. That's a great question. Hopefully, Dr. Hadi's feedback's given you some ideas on how to take that forward. I'm a little bit conscious of time because we've got 10 minutes left and so many great questions here. I wish this webinar was longer, in fact, because there's so much good stuff here. So there's a question which came in earlier from Rihab, which I think is really interesting, which I'd like to pick up if I may, and then run it past Jen and Bex. So he says, for those of you who haven't seen it, says from Lebanon, a country now facing economic, political and health and all kinds of crisis. So how to use digital to keep people living in this situation motivated with cancer awareness, prevention and early detection. And the reason why I wanted to come to this question is I think it's such an important issue. Understandably, it absolutely feels like the whole news and indeed health agenda at the moment is completely dominated by COVID. And obviously it is indeed the biggest story in town. Certainly here in the UK, some of the news stories we are starting to hear, though, is about the knock-on impact of delays in treatment to people with cancer, which almost feels like there could be a second public health crisis brewing on that front. So I'm so pleased that you've raised this issue, Rihab. Thank you for doing that. So perhaps we can talk a bit more about how we would advise Rihab. Jen, I don't know whether you've got any thoughts on that.
Yeah, I think there was also a similar question that came in before the session as well, which was around that kind of keeping people engaged and also like measuring engagement and things. And I think a lot of it is, it's all around the content that you put online. It's getting that content right. And whenever you're thinking about kind of what tools to use, where to promote things to, it's about the right content in the right place, and understanding where your audience are. So, you know, are they on Facebook? Are they searching the internet? Are they, you know, watching the news or reading certain papers or websites or whatever it is? And where are they, so that you can then promote and put on your kind of most relevant content. And I think especially, I mean, I don't know what it's like in Lebanon, but in the UK, as Zoe mentioned, things are starting to come out in the news around that kind of knock-on effect. And it's important for that early detection to still go to the hospital or to the doctor if you're worried, which for a while we were kind of told to stay away. But, and again, I know it's different in every country, but now it's kind of, you need to go. So it's kind of, how can you tag on to some of those stories that are already happening? How can you kind of get to where your audience is right now? So can you get a kind of press release out in the news so that it's reaching a lot more people? Can you join some groups on Facebook or something that may not be directly connected to cancer? It might be something slightly different, but it's where are those places that you can reach people to really kind of engage them with how important it is, that they are still checking, they are still going to hospital, they are still aware of all these, that cancer is still here. COVID may be here, but cancer is definitely still here. So how can we keep getting that into people, the forefront of people's minds? And it all boils down to that content that you get online. So how can you make it the most engaged? So can you get some relevant case studies of people who over the last 2 or 3 months have perhaps got their own personal stories of either realizing they have cancer, perhaps some less positive stories of people that found out too late or maybe almost too late, or those positive stories that people did still check. You know, it's getting those case studies and that content out there for people to see, and just making sure it's in the right place. Hopefully that kind of answers your question. Does anybody else want to share any examples of how they've done anything differently, I guess, at the moment in their particular situation, of how all the other things going on, how you can keep your voice heard above all the other noise?
Well, thank you for your answer. Well, you know, as you mentioned, it's about the right context and the right place. And now, unfortunately, most of the social media, where we already have platforms to raise awareness, they are overwhelmed with other news from all these crises that I mentioned. Mm-hmm. So again, I insist, COVID is there, but cancer is still there. And there is a fear that probably cancer numbers might increase in few years from now if we don't take care of cancer right now. So again, we have an unusual situation. It's not only about COVID, it's about economic crisis. So many people are leaving their work. They don't have the money to do the screening test. So we're doing our best. For example, we did an awareness campaign where we linked smoking is the highest risk factors. And now knowing that smoking also affects COVID, coronavirus infection. So we tried to link again, smoking, COVID, and cancer all together in a virtual competition that we targeted high schools, because we knew high school students, they were sitting at home. And usually we do have this competition in collaboration with the Ministry of Education and Higher Education. But because of COVID-19 this year, we run a virtual competition where we ask the high school students to educate the community about the risk of smoking on cancer and COVID-19. So we had to keep this COVID-19 issue just to attract more people to look at this campaign. So this is one thing that we're doing, but it is hard. So we had so many screening campaigns for colorectal cancer that all were stopped because of the lockdown, and later because of other crises. But unfortunately now, for example, we don't have electricity all the time. We're afraid that we might not have internet connection all the time. So we're trying to adapt, but it's not easy. So I appreciate all ideas how to keep motivating people about the importance of cancer prevention and early detection in these difficult times.
Rehab, thank you. And you're obviously doing this amazing, heroic job in incredibly challenging circumstances, and really admire what you're doing and your commitment to doing it as well. I'm so pleased you have raised this question, and Bex, I think, has some other advice for you as well, building on Jen's helpful tips about behaviour. So Bex, can you say a bit more about that?
Big thing with minutes to go. But I'm really I keep going on about behavior science because I really think it's the core of everything. I think some people will develop campaigns that aren't really tackling the deeper issues that people are struggling with. So I've just popped a link in the chat which you can all explore further. I think a really good starting point when thinking about any campaign, anything you do, I think it should start with behavior, and it should start with the COM-B model, which is quite a usable model. It's not like a complex science theory based model. It's one that works when you're developing campaigns and products, and it just means actually what we're trying to think here is, why are people struggling to hear these messages now? It's a bigger question than they're not necessarily seeing the messages. It's more than that. There's a lot going on with people. So we think about capability, opportunity, and motivation, and what's beyond that, what's going on deeper. So have a look at that link to have a look at thinking more about behavior science.
Thank you. I'll check the link.
Fantastic, thank you.
Sorry, can I just add, Dr. Rehab, I would be happy to share the whole training material with you. We have the whole COM-B, the full package, and I could, we could, this is, I agree, this is COM-B is amazing. This is, yeah.
I appreciate this. I'll send you my email.
Wonderful. That's great.
The last question, or I don't know, offer maybe. Thank you very much, first of all, because we are already finishing. And I just wanted to ask, maybe as it was a webinar about digital strategies, actually, we talked about many things, fundraising and communication methodologies and so on. But my concrete question is, so what is recommended? Which kind of digital strategies? How do you think for communication, for advocacy, for social mobilization? Most social media, more video-based education, more printed materials, or what? Because when we're talking about digital strategies, I really want to ask you, maybe we will have from UICC, from experts, some, like guideline or recommended toolkit of recommendations or something like this, with of course evidence-based, which we will use as a guideline to implement by our countries, by peculiarities of our population, the relevant digital strategies. because I am working for patients union and for hospital too. And there is various, of course, peculiarities for both populations. So I am offering, maybe somebody, some group of experts will elaborate some toolkit about digital strategies, which is already appropriated in some countries, some places. Thank you very much for this. I should leave. So thank you very much.
Oh, thank you. That's a really helpful suggestion. I think whilst there's a sort of strategy process, I think your ideal strategy is going to look different for every organisation, and as Bex and Jen would say, it's always going to come back to what your users want and need. So I think that's the key thing to focus on as you develop your strategy. I would love to go into this in more depth, but I'm conscious that it's 2 o'clock and people may have other calls to get to. So I just want to wrap up by saying thank you so much to everyone for coming today and for sharing such brilliant questions. Big thank you to Jen and Bex for sharing so much of their expertise and lots of great ideas, and thank you again to all of the delegates for sharing their own experience as well. So thank you so much everyone for today, and for also making this such a fun and interesting series, and hopefully it's been useful for you all in the UICC community.
Zoe, thank you so much. How could we stay in touch? We need, I mean, I know Sinéad, I know I'm not, but I think we really want to, if we could get your contact information and we could stay in touch, because this is something that's very important nowadays.
Oh, sure, absolutely. Well, I think my contact details are on the slide. So, Sinéad, if you're able to just send that out, we'd all love to keep in touch with you all.
I've just put the slide there again if anyone wants to take down the email address.
Okay.
Thank you.
Thank you.
Thank you so much, everyone. We really appreciate you having us today, and thank you, Sinéad, and also Alessandro in his absence for having us.
Thanks, everyone.
Cheers. Bye-bye.
Everyone.
Bye.
Bye. Bye.